Chittorgarh has a long history of battles. The Chittorgarh fort, the largest fort in India, stands witness to its heritage and glorious past. For a common passerby or a tourist, it would not look like a place where revolutions still happen. But thanks to an initiative, this hilly district in South Rajasthan has done something that no one could ever have imagined. It has laid the foundations for a healthcare revolution in India by making access to healthcare easier, even for the very poor, and that too at an affordable price. The availability of medicines in India today is one of inaccessibility amidst adequacy. There is an inadequate access and supply of even essential drugs to the poor, despite an adequate drug production. While the sales of Indian pharma companies are increasing steadily, drugs are getting away from the people, more so for the poor. How can we expect a person who can barely afford a square meal a day to spend enormous amounts on costly medicines? People are being pushed further into poverty, disability, and death because of these costs. More and more drugs flood our markets every year. There are over 1,000 pharmaceutical units in the country, producing over 1 lakh formulations of drugs. It is paradoxical that while essential and life-saving drugs are in short supply, more and more drugs which are not therapeutically effective, irrational, and maybe even dangerous are being produced and pushed into the market with absolute disregard to the country's health needs, especially in rural areas. The problem becomes more acute in developing countries like India, where the resources for the purchase of drugs are scarce. The situation in this part of Rajasthan was the same. It is just a quirk of fate that in the Indian market, thousands of medicines are available at an uncontrolled maximum retail price. If we look at the drug control scenario, in 1979, 347 essential drugs were under control. But in 1987, gradually, the basket of price-controlled drugs was reduced from 347 to 142. In 1995, this came down to 76, and at present, only 74 out of the over 500 commonly used drugs are under the statutory price control list. This means that for all the other drugs, companies are free to fix a maximum retail price of their choice. And this could be as much as 5 to 10 times the actual production cost, and may even be at the cost of many lives. This is Shantiram, who's still under shock after his wife's untimely death. Today, he's become the sole bread earner for his family and looks after his 3 children. Shantiram's wife was diagnosed with pneumonia. For them, medicines were too expensive. After taking a small loan initially, they bought the medicines, but later they could not afford them.
पहले क्या मेरी बीवी बीमार हो गई थी और हम खेत गिरवे रख के पैसे लाए, महंगे थी जिसलिए खेत गिरवे रख के लाया तो इलाज करवाया तो भी वो बच नहीं पाई। फिर बाद में हमारे 3 बच्चे हैं और अभी खेती का काम कर रहे हैं, उससे गुजारा होता नहीं, हम दान की करते हैं रात दिन।
And this is not only the story of Shantiram, but there are thousands of people like Shantiram in Chittorgarh who are facing similar situations. The healthcare facilities in Chittorgarh were grim. Doctors previously prescribed high-cost medicines, and the rural poor were forced to buy them from privately run medical shops. The debt trap and deaths were usual due to the non-affordability of high-priced branded medicines. For the people of Chittorgarh, it was a desperate situation, and they were hoping that the situation would improve. And the situation of the district did improve with the intervention of Dr. Samit Sharma.
I saw that the situation of healthcare is very poor. It is mainly because the cost of drugs is very high, and the poor people are not able to afford those medicines. And being a medical doctor before coming into IAS, I was knowing that the actual cost of production of drug is not very high, but the MRP is very high. It means it is possible for a drug to be made available at a very low cost compared to the price it is available in the market.
This is one of the 16 stores run by the Central Cooperative Bank. In this store, essential medicines are being supplied as part of a generic drug initiative, and the prices here are 40 to 50 and sometimes even 90% lower than other shops. Many such stores have been opened near the hospitals and are selling nearly 564 generic versions of the drugs. It is no surprise, therefore, that patients are flocking to these stores in large numbers. So much so that the administration now believes that there is room for a further drop in prices. It seems rather surprisingly unbelievable, but it is true, and it has been made possible. The project was initiated to bring down the cost of generic medicines in remote rural villages of India, and it certainly did that by providing quality drugs at less than 1/4 the prices at which they were sold in private medical shops.
Generic medicine is same as the brand medicine, and it is a medicine which is sold by its salt name or generic name and not by its brand name. It is generic medicine. So when a medicine is sold by a brand name, then branding creates artificial monopolies, and it becomes imperative for the patient as well as the chemist to dispense that particular medicine only, that particular brand only, which is of a particular company. But when a doctor prescribes medicine by generic name, then it is up to us or for the patient to choose among different brands.
To achieve this success, the administration first tightened its grip on the government-run hospitals and its doctors. They were disallowed from prescribing medicines by brand names. Today, doctors can only prescribe a salt's name, and the final choice of the drug to be bought, generic or branded, remains with the patient. As a second step, a massive campaign to promote generics was implemented. Every third street corner in Chittorgarh and the government-run community health centers in the nearby villages had signs which said, "Buy generic drugs, they cost less," or "Ask your doctor for generic medicines, they are just as effective." Cooperatives were then asked to procure generic medicines and supply them through a network of 16 stores. Tenders were invited by the cooperatives, and most bids were far lower than the currently retailing, and only pre-selected companies were allowed to bid. The results were encouraging. Doctors in the town, which has 2 large hospitals and about 50 private doctors' practices, report that patient numbers have increased by 15 to 40%, a sign that people are now more confident that they can afford medical care. Today, this unique initiative has completely changed the healthcare facilities for the poor. It is easily within their reach, as medicines are available at unbelievably low prices at the government and cooperative stores, much below the MRP. A cetrazine tablet, which has an MRP of 35 rupees, is available at 1 rupee 50 paise. An amikacin injection, which has an MRP of 70 rupees, is now available at 8 rupees and 67 paise, and there are so many other such medicines. Let us look at some of the generic names of drugs in Chittorgarh. Albendazole tablet, IP 400 milligrams. The Bhandar rate is 1 rupee 37 paise, but the MRP printed on the back of the pack is 25 rupees. Alprazolam tablet, IP 0.5 milligram. Bhandar rate is 1 rupee 75 paise for 10 tablets. MRP printed on the pack is 14 rupees. R-theta 2 milligrams injection. Bhandar rate for one injection is 11 rupees 72 paise. MRP printed is 99 rupees. Amlodipine tablet 5 milligram is available at the Bhandar rate of 3 rupees 12 paise for 10 tablets. MRP printed on the same unit is 22 rupees. Cetrazine 10 milligrams. Bhandar rate is 1 rupee 50 paise for 10 tablets. MRP printed for the same 10 tablets is 35 rupees. Ceftazidime 1000 milligram. The Bhandar rate is 64 rupees 90 paise for one injection. MRP printed on the pack is 370 rupees. Atrovastatin tablet 20 milligram. Bhandar rate is 22 rupees 59 paise. MRP printed on the 10 tablet strip is 170 rupees. Diclofenac tablet IP 100 milligrams. Bhandar rate is 2 rupees 75 paise. MRP printed on the 10 tab pack is 25 rupees. Diazepam tablet IP 5 milligrams comes at the Bhandar rate of 1 rupee 90 paise for 10 tablets. MRP printed is 29 rupees 40 paise. Amikacin 500 milligrams injection. Bhandar rate 8 rupees 67 paise for one injection. MRP printed on the pack is 70 rupees. Today, Dr. Samit Sharma's willpower to do something for the poor has shown results. The treatment cost of most illnesses in Chittorgarh has fallen sharply. There is an increase in the number of patients getting affordable drugs from the hospital supply. The state's medical bill for pensioners and others who access government health systems has also declined for the first time by about 4 crore rupees, mostly because people are spending less on medicines. Today, lower-priced drugs in government-run stores have put a pressure on private practitioners to follow suit. Private medical stores who've started to lose business due to the Sarkari stores are cutting prices, and the impact is spreading to other parts of Rajasthan too. 9 districts, including Jaipur, Bhilwara, Jalore, and Sirohi, are now procuring drugs from Chittorgarh cooperatives. In fact, in districts such as Jhalawar and Bundi, drugs must now be procured at Chittorgarh rates, and in some cases, just by removing the middleman, there is sometimes as much as a 700% reduction in prices. Even individual patients from adjoining districts have now started rushing to Chittorgarh for medical supplies. At any given time, orders worth 2 to 3 crore rupees are waiting to be shipped to the nearby districts by the cooperative. The medical store at the district hospital for women is in a perpetual state of flux because of the demand. Letters exchanged with the Pali district show an order worth over 5.7 lakhs. Another from Kota is a demand for 1 crore rupees worth of generic cetrazine. Today, Shantiram can afford medicine easily. The Chittorgarh administration has made sure of that. As per an estimate, over 5.1 lakh patients have procured low-cost drugs in Chittorgarh district alone. But is the initiative sustainable in the long run? Yes, it can be sustained by simply taking two simultaneous measures. That is, the availability of low-cost drugs at government medical shops and the rational prescriptions by doctors. Dr. Samit Sharma today has become a household hero as he has done something for the poor. His able leadership abilities have created a synergy between the government doctors and the machinery in the health department, cooperative department, district administration, and finance department. And the results are astounding. For his contribution to the unprecedented healthcare facilities for poor citizens of Chittorgarh, on the occasion of Civil Services Day on the 21st of April 2010, Dr. Samit Sharma was awarded with the Prime Minister's Award for Excellence in Public Administration for the year 2008-2009. Today, the initiative has prevented poor families from falling into a debt trap on the account of medical expenses. The affordability of medicines has helped them to willingly seek medical treatment, and they are marching towards progress in a way, building a healthy and prosperous nation.